Hey, Dr. Christopher Kawa here from Function Based Wellness. I am a doctor of chiropractic and a wellness specialist, and I've been practicing for 30 years right here in Brick, New Jersey, and helping my patients, thousands of them, get over all kinds of function based situations, and thyroid is one of them. Your thyroid gland, as you probably know, is the master of your metabolism. It secretes a hormone called thyroxine that basically regulates your entire metabolism, which is pretty amazing. Unfortunately, thyroid malfunction is very poorly diagnosed. As a matter of fact, it's one of the top 5 most misdiagnosed conditions that there is. And you have to ask yourself, well, why is that? Why after all these years is thyroid malfunction so poorly diagnosed? And I think it's basically because doctors who are specialists look very narrowly into these types of issues. They look at part of the picture, but not the entire scenario. They look at one organ or organ system without regard to how the other organs and organ systems relate to the function of this particular organ system. And as you'll see, there's a lot of other issues that can be present that cause thyroid malfunction. Now, they say a specialist is a person who knows more and more about less and less. And this was a quote by one of the founders of the Mayo Clinic. And it's very true. Like when you narrow down the focus on something, you kind of lose your ability to look at the whole. And that's what functional wellness does. We look at the whole picture and not just individual organs. Now, here are the most common myths about thyroid dysfunction. Number one is if you go to the doctor and you get your TSH measured and it's high, that the body's just not making enough thyroid hormone. Well, that could be the case, but there's a lot more to it. It's just not as cut and dry as that. But most people, they'll go and they'll get their TSH measured, it's high, and they're just given a prescription for levothyroxine, which is involved with myth number 2, which is the most commonly prescribed thyroid hormone, which is levothyroxine, is all that's needed to correct a sluggish thyroid. And we know that's not true because there's millions of people who get thyroid hormone, but it's just not fixing the problem. It could be a liver problem, could be a gut problem. The liver converts the inactive form of thyroid gland to the active form, and maybe that's not occurring. So we have to look at all these things. And that has to do with myth number 3, which is the thyroid acts independently of all the other organ systems, and we know that's just not true. Now, the secrets to solving the thyroid puzzle are first getting the right tests. We have to figure out what the real problem is. Is it just because the thyroid's just sluggish, or is it because there's an autoimmune issue going on? Is it because the liver, you have non-alcoholic fatty liver disease and your liver's just not converting? The second secret is understanding the relationship between the thyroid and other body systems, particularly the HPA axis and the gut. The HPA axis is the hypothalamus pituitary adrenal axis, and it's responsible for coordinating the delivery of many chemicals to the body and the brain and from the adrenal gland, and also the gut. Number 3 is fixing the underlying problems, and this is one of the secrets, using a holistic functional approach, not just a cookbook approach like the average specialist does. And then number 4 is covering all the bases to not only fix the thyroid, but to set a course towards true healing. Because the only way you're going to truly heal from anything or maintain your health is if your body is functioning properly. And that's what functional wellness is all about. And that's what we do at Function Based Wellness, our company. So I want to introduce you to the NeuroRhythm Metabolic Reset, the NMR. Now, the NMR is probably something you've never seen before. It's a state-of-the-art breakthrough 7-phase protocol that addresses all the aspects of not only thyroid dysfunction, but a lot of other issues that are causing ill health in millions of Americans, and that is immune function or malfunction, weight gain, stubborn weight gain, adrenal burnout, fibromyalgia, and many other conditions. Now, the NMR is a 7-phase program, and it covers all the bases. And you'll see here the phases. Phase 1 is the HPA axis and brain chemicals. Phase 2 is getting the liver to cleanse and detoxify so they can do its job. Phase 3 is getting a personalized diet based on your physiology and a supplement plan that's based on what's going on with you, because everybody's so different. That's one thing about, functional wellness is you learn that everybody has a different physiology, different issues going on, and you have to really individualize the programs. Phase 4 is balancing the sex hormones. Phase 5 is dealing with digestive issues and reestablishing a proper microbiome, which is all the gut bacteria. Phase 6, really important, getting rid of metabolic syndrome, which most people have, which is a whole host of issues that relate to chronic inflammation and insulin and the like. And then the last phase is getting the genes to express your God-given natural ability to be healthy. And we know now that genes are not just passed on, they are switches and they turn on or off based on your lifestyle. Now, if you'd like to find out more about the NMR method, we have a system in place that can help you do that. Now, what we need to do is first we're going to talk about the benefits. Now, the benefits of the NMR are improved thyroid function, healing the liver and the gut, weight loss, especially that stubborn weight loss, improving your libido and sexual function, making sure your digestion is spot on, lowering your insulin levels, which is crucial, increasing your lifespan and your quality of life, which is just priceless, and decreasing the chances of especially cancer and heart disease. Those are the two main ones that we're trying to lower the incidence of, and much, much more. Now, to find out more about the NMR, here's what you have to do. We have a link down below that you're going to click to get a 15-minute discovery call with me, Dr. Christopher Kawa. I'm a functional wellness specialist, so I've dealt with these problems, and I've developed this NMR system to deal with thyroid dysfunction and many other malfunctions that people are dealing with. But number one is you have to be ready and willing to do what it takes to change your life. You have to come to this call like, wanting to make a change, right? So what I'd like you to do is write down the 5 most important questions you have so that we can go over these questions with you on the call. And when you do schedule a call, we're going to send you a link to go on the FM Logix system and fill out the questionnaire. This is an amazing questionnaire. It's going to take you about 20-30 minutes, but it is the most comprehensive questionnaire about health that you'll ever take. And it's computerized, so it has a built-in algorithm that is going to be able to tell me what the probability of malfunction is, to what organ system of the body is involved, and I'm going to be able to tell exactly where we should look to help you with your thyroid dysfunction and other health-related issues. Now, number 5, please show up to your discovery call ready to learn. And number 6, all you got to do is click the link below to schedule. And we look forward to talking with you and teaching you about what the NMR can do for you. And we'll talk soon. Thanks.